Hi, my name's Carl Heneghan. I'm Professor of Evidence-Based Medicine at the University of Oxford. I'm also Director of the Centre for Evidence-Based Medicine. And my presentation was about evidence-based medicine. What is that? It's the use of the best available evidence integrated with clinical experience and patient decisions to make better decisions in healthcare. But the problem we have is with the quality of evidence that exists today. To make decisions, you need high quality evidence. However, there are problems that exist with the outcomes. There are also problems with too much bias in research, and also in the way we develop and disseminate and interpret research. And when you understand these structural problems, you see there's a real issue in research. I talked about the overwhelming amount of research. There's about 1.3 million articles indexed on PubMed each year. There are about 30,000 plus clinical trials. Yet when you ask a question, where is the evidence that makes a difference to clinical practice? It's very hard to find the evidence that actually reduces uncertainty and benefits patients. Why is that? We do too much research, and what we need is less research, but better quality research. And a colleague of mine, the late Doug Altman, said that 30 years ago. And we failed to learn the lessons of that. We fail to understand that if we don't step back and improve the quality of research and have an approach to research integrity, we're going to continue to produce evidence that's beset by problems. Take outcomes, for instance. There are far too many trials with surrogate outcomes, composite outcomes. I showed the problems of reporting and publication bias and also switching of trial outcomes. The majority of clinical trials published in the top medical journals switch outcomes on a very frequent basis. Yet, when we tried to fix that, they didn't want to know about how you go about fixing that. And then at the end of the presentation, in showing all of these problems, we talked about redefining the E in EBM. That evidence is an ethical issue, that we should improve the quality of evidence. And if we do that and train the next generation, we can identify and fix the problems in research, we can develop better research, and then we can also think about adding capacity in researchers for tomorrow who actually understand research integrity, understand high quality evidence, and produce some evidence that can help clinicians and patients make a better decision.